Hi everyone, my name is Dr. Chrisi Silva. I'm Chief Behavioral Health Officer at Fusion Care Group. Thanks so much for joining us today, and I wanted to share some information about depression. So right now with our society and our culture, we are going through some major transitions, and COVID is at the top of the list, also the protests that are going on. And so a lot of people are now reaching out saying, I'm feeling super sad, super stuck, super depressed. And so I thought it would be important to reach out and let everybody know a little bit about depression and what might be normal versus when you need to reach out and get help. So emotions are like roller coasters, up and down, and that's what we want to expect as normal in our society. And some days we're going to feel sad, some days we're going to feel happy, some days we're going to feel wonderful and amazing, and other days just kind of apathetic. And so those are normal mood fluctuations. And usually what we can do is tie that back into something that happened. So for example, right now what would be normal with everything going on in our society is more anxiety, more feelings of sadness or stuckness. I just don't know what to do about this. And I feel just kind of a loss of interest and maybe a little depressed and not happy about anything in my life. And so my goal as a therapist is to figure out what might be normal reactions to everyday situations that could be triggering, such as what's going on right now, and then what leads into clinical depression. So obviously you can get help for either of these implications. So even if you're just feeling sad and you want help with coping or reaching out or support, feel free to reach out for therapy. I think it is important to have support and get some guidance through these times. But clinical depression really is truly different. It is a period of over 2 weeks where you're feeling a change in your feelings. So feelings that are associated with depression are guilt, feeling like you're not doing anything right, obviously feelings of sadness. Some people actually have tears and extreme feelings of sadness, or maybe just more of an apathetic, I just feel kind of blah. You can also feel worthless, and men tend to feel more agitated or angry than females do. So those are some of the feelings you might be experiencing that go over a 2-week period. And then you have behavioral changes. So you might notice that your appetite is going up or down, overeating or undereating. Your sleep is impacted, and your social relationships, so withdrawing more, not wanting to talk to people, less activity, less motivation. Those are some of the behaviors that we look for. And then of course the last is our thoughts. So when we are going through clinical depression, what happens is our thinking tends to get more negative. What's the point? Why am I doing this? Maybe thoughts of suicide, and just feeling like the thoughts are not constructive or helpful, no motivation in our thoughts of positive things that are about to occur or happen. So that is the major difference between just feeling sad temporarily over a situation and clinical depression. Clinical depression sits in longer. It feels a little bit more helpless in that there really isn't a cue as to why you feel this way. You just feel this way. So some people will ask you, well, why are you sad? What's going on? And someone who's depressed might say, I don't know. I just have no answers. I just feel blah or sad. My body hurts, my head hurts, I'm tired, I feel like I have bricks in my body and I can't get up the motivation. And so the normal things that we would say as a coping skill for, say, someone who's just sad over a situation or a breakup, to get motivated, go exercise. These are all great tips to use. But when you're depressed, you can see how hard it is to actually utilize those coping skills. And it actually needs to be managed slightly different. So if you think that you are going through clinical depression right now and are experiencing any of these symptoms over a 2-week period, please reach out. There's no reason why you need to suffer or feel this pain or endure it. Most of the time, it unfortunately doesn't just go away. What I've noticed in my practice is that the brain and the body actually gets used to working in certain zones. And so if you've been depressed for a long period of time, sometimes it's harder to jump out of it. And so getting support, having a therapist, and discovering where the depression might come from, and then looking at ways to cope and looking at additional forms of treatment to get some assistance is going to be crucial. So please reach out for help. Life is too short, and we want you to be happy and feel good and enjoy life and not suffer. And we're here to support you with that. And again, if you're just experiencing sadness and it's not clinical depression, that also means you can reach out for help. Help is out here for anyone who needs it. If you need support, if you need guidance, coping skills, we're here for you guys because we want you to live a life that's full of happiness and contentment and not have to endure or suffer. So thank you so much, and please feel free to reach out to the information below and subscribe if you like our information, and we'll have more to come. Thanks so much and have a great day. Bye-bye.